I wanted to first share, and I know I speak for everyone in BC, my deepest gratitude to emergency crews, healthcare workers, health authority employees, BC Emergency Health Services, and ministry staff for everything they've done over the past couple of days to keep people safe. This includes a significant efforts to safely move patients and residents of long-term care and assisted living out of flood areas. About 150 have been moved so far, principally from Merritt, and another 48 are expected to be moved in Princeton in the next little while. Those are significant and difficult things, and especially our teams in Interior Health have done an extraordinary job, I think. Paramedics were there yesterday to assist those being evacuated by helicopter on Highway 7. Whether our lives have been directly impacted by these events or we have seen their impact on others, what has touched all of us and will continue to as the recovery proceeds are the efforts of emergency and healthcare teams, local and regional governments, volunteers, friends, strangers, and passersby who have offered a handout, support, hands of assistance, and other welcomes, supports, and comforts in evacuation areas. All British Columbians are thinking of those who have been impacted by the heavy rain, severe wind, and significant flooding, and respect their strength, resilience, and courage. Minister Farnworth will continue, I believe, later today to have updates on the flooding impacts with ministry and emergency officials. With that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. I also would like to start by recognizing the communities that have been affected by the recent flooding and landslides across much of the province over the past few days. And I'm very grateful for very strong community support that has helped people get through this and the heroic work of our emergency services. I have a meditation teacher that used to talk about this too, and sometimes it's a challenge for us that we have been through so much in this past year and a half, and now this too. But it is our sense of community and strength that will keep us strong and get us through this one as well. In this global pandemic, we have learned as much as we can from watching what's happening around the world. And currently, watching what's happening in Europe and the UK has meant that we have had to look carefully at what we're seeing here in British Columbia as well. If we think of Austria and Germany and the Netherlands, Finland, it reminds us that we are not yet through this pandemic, and we need to take a slow and measured response. Last week, I was asked about new potential variants of concern in our province, and particularly we talked briefly about the Western lineage that has been seen in BC and Alberta and Saskatchewan. And today I'd like to report that we've had our first confirmed cases of the AY 4.2. So this is one of the Delta sublineages, and we talked last week about the fact that as the virus replicates and affects more people, it mutates. And there are now about 120 different sublineages of the Delta strain of the virus around the world. And we've seen here in BC, and as mentioned across the West, the AY 25 and 27. And these were first found in British Columbia around June, and now is about 2/3 of the cases that we're seeing. All viruses mutate, we know that, and development of these new lineages, which are unique to geographic areas, are really expected over time when we have ongoing transmission in our communities. We are watching closely, particularly now with these new cases of AY 4.2, and this was a specific mutation that's been found in the UK. It's not yet its own variant of concern, and it's one of the other things, the language and the nomenclature of how we're naming these lineages and clades and subclades has been changing as well. But we are continuing to follow the whole genome sequencing and making sure we're aware of what strains are being transmitted here in British Columbia. What we are looking for is whether these variants of interest and concern are spreading more quickly or making people sicker, and of course we're watching very carefully to see if they're associated with less effectiveness of the vaccine. So far, what we have seen and what we've talked about over the last number of weeks is the fact that the strains of the Delta variant that we're seeing are spreading much faster and causing more severe illness in younger people, and that remains the same. And our best defense continues to be being vaccinated. We're now starting to receive a small number, and we received our first shipment of the Johnson & Johnson or Janssen vaccine. It's a viral vector, single-dose vaccine, though we likely are going to need a booster dose at some point. But as I mentioned last week, our priority is to make this vaccine available to people, healthcare workers who are affected under the Provincial Health Officer Order, who wish to be immunized and are currently on leave so they can return to work. However, we expect that we will be getting some more in and that we will have more than we need to address the needs of healthcare workers affected under the PHO order. So if you are somebody that would like to get this vaccine, the way to do that is to contact Immunize BC call center at 1-833-838-2323 and let the agent know that you'd like to be put on the wait list for the J&J or Janssen vaccine. You will be transferred to what we call the complex cases line, where your information will be collected. And if you are a healthcare worker, let the agent know that as well. And then once we have an understanding of how many of people affected under the PHO order require this vaccine, we'll be contacting others to connect you to doses in your community. I would like to reiterate that we have about 5,000 doses that have come into the province just this past weekend. And so that's what we'll be working with right now for the next couple of weeks. But if this is of interest to you, then I encourage you to call the IMSBC contact center. I also want to take a moment to talk about immunizations for children 5 to 11 years of age. We anticipate that Health Canada will likely be coming out with their recommendations around use of this vaccine for children very soon. And we have been reassured that there will be enough vaccine for the just over 300,000 children in this age group here in British Columbia. We expect that Health Canada will make their decision after a thorough process to review all of the data, and we've seen that the importance of this independent review of the safety and how well the vaccine works, the effectiveness of this vaccine for children, and we are counting on Health Canada to continue to do that due diligence with this vaccine, and I know that they are doing that right now. And the National Advisory Committee on Immunization is working closely with them to look at all of the data on this vaccine and on children, and will issue their recommendations at the same time as Health Canada recommendations come out. So that's great news. That means that we'll have that thorough, independent review that we can rely on for making decisions. I also want to talk a little bit about this vaccine. We've said a few times that this is a version that is designed specifically for children. It has a smaller dose, about 10 milligrams, in a smaller amount, and that will mean less pain and discomfort with the shot. But also it means that this is tailored for the immune systems of younger children so that it doesn't cause as much side effects, and it can be strongly effective as well. So those are good things. I think it's important for us to recognize that we had these vaccines that have come out and been used in millions and close to billions now of people around the world, and we know a lot about them now. This is, and the extension of these use to younger children has now been done in a way that specifically looks at how the immune system of young children respond to the vaccines and respond to any vaccine. We know that younger children have good, strong immune systems for the most part, so they don't need as much of an antigen boost. We've also known, and I was talking with my colleagues from the United States, and they have rolled out the vaccine program for young children in the U.S., and we're getting lots of great information on safety and how well the vaccine is working there. If and when it is approved and we start to receive doses in BC, we'll be starting to contact parents who have registered their children. And this is a good way to make sure that you can get access to the vaccine as soon as it's available. So by registering now, your children will likely, we expect, be able to receive this vaccine before the upcoming holidays. And I encourage parents to think about this now. Of course there's concerns. We all want to make sure that we're doing the best for our children, and we want to make sure that these vaccines are safe and are going to work. So speak to your family doctor, your pediatrician, your pharmacist. Get that information that will help you make those decisions about what's right for your child. Use some of the established and credible resources that we have. We have information up to date so far of what we know at the BC CDC website. And I encourage people to as well go to the tool hashtag It Does Not Have to Hurt. This is a program, we have expertise in Canada that has been involved with looking at how do we get vaccines in a way that's safe for children and minimizes the pain and the concerns that children have in their vaccination programs. There's some really good information on this that can help parents and children understand what to expect and how to prepare for receiving their vaccine. These are excellent resources that make the experience better for your children and for you. I also encourage parents to talk with the young people, their children, to understand their concerns and to help prepare them. These are things that we can do that can support our families and our communities. And we often don't know exactly what the anxiety are that young people have or what they want and their preferences are around vaccination. So as these vaccines are coming, we will be providing as much information as we can about how the vaccines work, how they work in young children, what we're seeing in terms of side effects, and how to prepare. But I encourage people now to start looking at this to be able to support your children in being vaccinated so that we can protect them. We know that for the most part children have milder illness, but we can't tell which are the children necessarily who are going to have more severe illness or are going to develop longer-term concerns and complications from COVID-19. Vaccinating children in the younger age group will not be mandatory, but it will give your children as much protection as possible. The best path to immunity is not through illness, is through immunization, and I encourage parents across the province to start looking into that now. As well, I want to say that our influenza immunization campaign is going ahead. As we know, we have started to see some more cases of influenza in the province. We've had about 27 confirmed cases, but most of them are in children who've received a vaccine, so that's good, or are travel related. So the number of cases that we're seeing is still small, but we know that that can grow quickly. That's why I strongly encourage everyone to get their flu vaccine before we get too far into the holiday season, especially if you're going to be around people who are immune compromised or are older people in our lives. Like COVID-19 vaccines, influenza vaccines protect you and protect those around you. Finally, I want to talk a little bit about masks. We've had some updated information that the Public Health Agency and Health Canada have posted about masks. And as we've been moving through this pandemic, we've been learning more and more about the importance of that extra layer of protection, particularly in the winter months when we're moving indoors. As it gets colder and more of our activities move indoors, we come into closer contact with others outside of our household, and that means risk goes up, and particularly in settings where there's more of us crowded together, where the ventilation is not as good. Masks become one of those incredibly important safety layers that are particularly important as we move through this winter season. And the mask, one of the things about masks is the layers. The best mask is the one you are wearing and wearing correctly, the one that comfortably covers your nose and mouth and chin. And if you have underlying health conditions or immune compromise, then you might want to choose a medical mask. And this is more information that we're finding, is that medical masks do have that extra layer that attracts particles and droplets and viruses, which is why they can have a better filtering effect to protect you from breathing in viruses. They are also certified. Medical masks and respirators are certified by Health Canada, so they have to meet specific standards. However, we do know that they can be challenging for people. They can be irritating and they can cause it to be more difficult to breathe. So if you choose to wear a non-medical mask, then we want to make sure that you're wearing one that has the number of layers of protection, that it fits snugly around your nose, and that it has at least 3 layers, and that can include a filter layer in the middle, and that it's made up of tightly woven fabric. So I'd encourage people to have a look at the new guidance and some of the information around masks that are on the Public Health Agency of Canada website. The other option that people can take is to wear a medical mask and a non-medical mask on top to help improve the fit around the mouth and nose. It's been a strong recommendation for some time, but as we're moving into the next few weeks, it is important, particularly as we head into the holiday season, that when we're indoors in public spaces, when we're indoors around other people, that we, as many of us gather to celebrate important religious events, for example, we want to ensure everybody has the best protection possible, and that includes, right now, being consistent in wearing masks when we're in indoor spaces. Yesterday, the Attorney General announced the intent to introduce a bubble zone around schools and healthcare facilities. Safe, unrestricted access is critical for everyone receiving an education or requiring care. So I just want to add my commendation to the Attorney General for this decision. I know it is important, and I think it's an important piece of legislation to protect our healthcare services and our education and schools. So to sum up, the pandemic is still very much with us, and we must all continue to proceed with caution. We're closely watching what is happening elsewhere in the world as other countries experience surges in new cases and the strains on their healthcare system. We have been there, and we continue to have strains on our healthcare system here, but none of us wants to get to that place again. It's going to be challenging to get us through this winter, but we know what we need to do, and we can do it together. That's why I'm asking all of you to keep our walls of protection and our layers of protection strong. We need to support each other, to do our part, to encourage each other to get vaccinated, to get the information we need to make sure we can make that right decision, and to do all of those things which will help us get through this winter. That means, of course, staying home when we're ill, keeping our groups small, choosing outside instead of inside, washing our hands regularly, and making sure that if we're particularly to honor our seniors and elders and those amongst us who are immune compromised, to make sure that we are vaccinated so that we're not putting others at risk and we're keeping safe ourselves. Thank you very much.
Thank you very much, Dr. Henry. And we have, I just have a few updates with respect to vaccination and surgeries and influenza vaccines, and then we'll move on to questions. Firstly, and this is, if you look nationally or internationally, extremely good news. 4,209,074 people in BC have received their first dose immunization against COVID-19. That's 90.7% of all those over 12. 4,026,399 have received their second dose or fully vaccinated. That's 86.8%. The number partially vaccinated is now under 4% who've received one dose but not their full course. And now, of course, with the addition of booster doses for many vulnerable British Columbians, we've done, in terms of third doses, sometimes called booster doses, 242,460 of those. That's about 5% of the BC population, but importantly, almost 150,000 of those for people over 70. That's 20% of that population, and certainly, I would say, shows the significant efforts that continue to be made in this period to make sure that our most vulnerable people in BC are safe. Just an update with respect to the vaccine status of health authority healthcare workers. This excludes long-term care staff. The total number of all those unvaccinated is 2,885, which is down again. But importantly, and just importantly, because of new additions as well, 125,190 fully vaccinated and 1,265 partially vaccinated. The fully vaccinated number continues to increase across the system. So that means basically 98% vaccinated, 97% fully vaccinated, 1% partially vaccinated, 2% not vaccinated. And of those not vaccinated, 974 casual employees, 942 are full-time, 15 not specified in our data here, and 774 part-time. So we continue to make progress with respect to the vaccinating healthcare workers, and the fact that 126,455 have been vaccinated demonstrates the strong support from healthcare workers for those efforts and for keeping everybody in healthcare and by extension patients and residents in long-term care safe. Those efforts continue. I want to report on the numbers of influenza vaccines that have been doses that have been administered in BC. That's 721,246 doses, of which 533,417 have been done in community pharmacy. Those numbers, there's a little bit of a lag time in reporting sometimes, but that is a significant progress in our influenza campaign. I just note that 2,039,000 doses of influenza vaccine have been distributed across BC to community vaccine providers, both in health authorities and in community pharmacy, and that effort continues while all of these other efforts are taking part in healthcare, and we want to particularly give a shout out to all those in community pharmacy who are supporting those efforts. It's a significant, I think, and continuing achievement. And as you know, in the past, less than 50% of influenza vaccines were administered by community pharmacy, and as you can see by the numbers, it is a very significant majority of those vaccines now being delivered in community pharmacy, and we are both appreciative and grateful to all those who are working on that campaign and encourage everyone to get your flu shot. I wanted to just report on contact tracing that over the past week, an additional 37 staff have been added to support contact tracing. That's for a total of 1,632 as of November 12th. To put this in context, in May of last year, when we had more than 10,000 active cases of COVID-19, we had 1,563 contact tracers in place. We've now surpassed that number. And with respect to surgeries, since May 2020, as you know, we made our surgical renewal commitment to patients. We've shared news on our progress. Sometimes the progress, as you know, has been extraordinarily strong in that period, and our teams have done an amazing job. At other times, when COVID has fought back against our efforts to stop the spread, our progress has been tempered by great challenge. Our weekly reports, I think, are encouraging for this reason. They show how all those involved in delivering surgeries, week in and week out, especially when challenges abound and setbacks seem insurmountable, get patients the surgeries they need. Each week, all those involved in delivering surgeries do just that. They deliver surgeries, and each week is my honor to report on their unyielding achievement. This week, we continue to face challenges in interior health. COVID outbreaks at Royal Inland Hospitals have caused a reduction of 6 operating rooms. While the outbreaks are managed, 3 operating rooms remain open for emergency surgeries, urgent cancer surgeries, and urgent C-sections. We will resume scheduled surgeries at the hospital when it is again safe to do so. That has always been our commitment, and it remains our commitment. To that point, Northern Health, which has faced significant challenges from COVID-19, is slowly increasing surgery at University Hospital of Northern BC in Prince George and at Dawson Creek District Hospital. I know, how important every surgery is to patients and their families. This news out of Northern Health shows that where we face challenge and experience setback, we make every effort possible to get patients the surgeries they need. At the same time, and I want to say this is something we reported on consistently, 123 critical care patients have been transferred out of Northern Health since September 5th. The vast majority of those have tested positive for COVID-19. The vast majority of those are unvaccinated. And the efforts in other health authorities to support Northern Health continues, and we are proud of those efforts and proud of all of our extraordinary teams in Northern Here's this week's update on our surgeries. Some surgeries continue to be postponed. During the reporting period November 7th to November 13th, health authorities postponed 174 non-urgent scheduled surgeries. That's 43 in Fraser Health, 3 in Northern Health, 25 in Vancouver Coastal Health, 21 in Vancouver Island Health, and 82 in Interior Health. No surgeries were postponed in the Provincial Health Services Authority. So cumulatively, from September 5th to November 13th, there have been 2,845 surgical postponements. Despite these postponements, surgeries are continuing across the province. I want to update the numbers because we've had full reporting for the period October 17th to October 23rd, our last full period of reporting. Health authorities report in that period that 7,148 surgeries were completed. That's an update from last week. This is 1,217 more surgeries than the same week in 2019, although that week in 2019 included Thanksgiving. But whether they're delivering surgeries, providing critical care, or ensuring emergency departments are there for it, our healthcare teams can't do it without us. Our continuing effort to stop the spread, our effort to keep our healthcare system strong. I want to say, just in terms of capacity of our healthcare system, you'll know if you're listening to these reports that we have about 9,229, exactly 9,229 base acute care beds in the province. We have 2,353 surge beds in addition to that, for a total of 11,582. As of Monday morning, 9,137 beds were full. With patients, so that is almost all of our base acute care beds. In critical care, we have 510 base beds, 218 surge beds, for a total of 728. And as of Monday morning, 459 of those were full. Those numbers in the course of a week will bounce around somewhat, but it just shows how intensely busy our healthcare system is and how much all of us need, all of us, to do our job, which is get vaccinated, get our flu shot, use our COVID sense, follow public health guidance. When we do our job, we make a difference in the life of everybody in the healthcare system and the lives of all those people who, for of significant variety of reasons, need help in the public healthcare system today. I ask everyone to get vaccinated against COVID-19, get your flu shot, and stay safe. We're happy to take your questions.